Is your pet having GI symptoms like vomiting, diarrhea, or maybe they're just picky with their food? Maybe you've gone to the vet and tried medications and the problem keeps coming back. I'm Dr. Katie Woodley, the natural pet doctor, and I'm going to share our 3 steps that you need to know about to find out why the symptoms aren't going away to help you get to the root problem and fix it for good. If you haven't subscribed yet, hit the subscribe button and bell to be notified about every time I post a new video about holistic pet care to help your pets achieve optimal health. And if you're wanting more help and guidance on how to treat GI disease with natural remedies, make sure to check out our webinar by clicking the link below in the description. Let's get started. So there's a lot of different ways that we can diagnose GI disease. First step, this goes for any disease, even routine care. I want you to be asking for at your pet's annual wellness exams, especially if they're healthy and especially if they are displaying GI distress and symptoms, we need to be getting full blood work done. We need to be checking red blood cell, white blood cell counts. We need to know if they're anemic. We need to be looking at kidney values, liver values, protein levels. Those are all very important. So your CBC biochemistry panels. Also, if your pet is having issues, any type of health issue, we need to ensure that we're testing for thyroid diseases. Thyroid disease goes missed so many times, and it's because a lot of times we're only checking a T4. We need to be checking for autoimmune diseases, autoimmune thyroiditis. We need to know, is the body mounting an autoimmune response and attacking the thyroid gland? Because the thyroid hormone is essential for so many different parts of the body working well. Very important. We also need to look at urine testing. We need to see, is there an infection? Is there a UTI? Are we losing protein through the urine? Do we have leaky kidneys? Are we concentrating urine? Also, we need to be checking for if there is a chronic GI issue or your pet's going through this up and down cycle where they're okay, but they seem really sensitive. They could have a chronic pancreatitis condition where inflammation is flaring up in the pancreas and it's making them not feel good. It could be leading to things like vomiting and diarrhea, and this can go for both dogs and cats. So checking what's called a SPEC CPL or a SPEC FPL for your cats. This can be added on to the CBC and the biochemistry profile, and it's specifically looking at inflammation in the pancreas. Very important to know because then it'll help you adjust diet using lower fat diets, but also then using more natural anti-inflammatory natural remedies to help regain homeostasis in the body. We also need to be doing fecal testing. So anytime you go into the vet clinic, grab a stool sample and bring that in with you because we need to make sure we're ruling out parasites. We need to make sure we're ruling out Giardia. There's some tests on the next slide that are very important for cats that are also commonly missed when our cats are having chronic GI issues. Now, keep in mind, one stool test may not show parasites. So your veterinarian, even holistic veterinarians, may recommend using something like Panicure treatment. If everything else is testing like negative and your pet's still having issues, they may recommend a dose of Panicure to deworm them that covers a broad spectrum of parasites. So keep that in the back of your mind if they're like, this is why we're doing this. But what you can do is you can bring in more than one stool sample from different days and combine them. We don't need a lot, so you don't need to bring in like a huge pound of poop, but you can grab a little bit from different days. And hopefully what we're doing is we're sampling if that parasite is what we call an intermittent shedder, we have a better chance of seeing eggs or cysts in that stool sample. So that's another way that you can help make that more effective as a test when you do go into the vet clinic. Now, okay, that was kind of like the basics, right? But what if your pet is having chronic GI issues? So we're seeing diarrhea, we're seeing gas, we're seeing vomiting, we're seeing bloating. It's not getting better. It's not going away. If you have a cat that's displaying these symptoms, you need to be testing for Trichomonas vitis. This is a separate
panel that needs to be asked for at the labs. So bring that up to your veterinarian if they haven't brought that up to you, because I have diagnosed numerous cats with tritrichomonas, and they don't tend to respond to your traditional medications that a lot of veterinarians use for normal GI upset. Also, you want to be looking at fecal, feline, or canine diarrhea panels. These are going to help rule out infectious diseases. Texas A&M has a GI panel that looks at folate, cobalamin, B12. We'll look for pancreatitis. We'll check for if your pet's not producing digestive enzymes. Also, if you are dealing with chronic GI upset, so your inflammatory bowel disease, protein losing enteropathies, you need to make sure that your veterinarian is testing for vitamin D. A lot of times with chronic GI upset, and also a lot of chronic health issues, that means the health issue has been going on for a long time, vitamin D levels are low. And we don't know, and I don't recommend supplementing unless you actually know, because it's a fat soluble vitamin and we can cause harm. So ask your veterinarian to run that. VDI is a great lab that will actually test for vitamin D, magnesium, B12. They have other cancer screenings too that they do, and they'll tell you how much, they'll tell the vet actually how much to dose for B12, for vitamin D, for magnesium if it is low. So they make it super easy for your veterinarian to give you a recommendation. And then also the most invasive, of course, is your intestinal biopsies. So if there's concern, or stomach biopsies. So if there's concern for chronic GI issue, that's where your veterinarian may decide to go ahead, do the anesthesia, do a biopsy, and actually get some information on what exactly is this disease that's causing it, and then go from there. There are other ways though. So this is where, are we having year-round problems? Are things continuing? And keep in mind, you can use these for intermittent problems also. So animal biome is a great test that you can use to check the stool sample and get an idea of the general population. Are the good bacteria outnumbering the bad, or do we have an imbalance? Do we have dysbiosis occurring that's causing this problem? Nutriscan saliva tests are also really good for food sensitivities. Now I'm saying sensitivities, food allergies and sensitivities are not the same thing. We're going to talk a little bit more about that. You can also do a novel protein limited ingredient food trial. So if you're worried about the financial aspect of all of this, pick some meats, one meat that your pet's never been exposed to. So maybe goat, maybe bison, maybe rabbit. And that's the protein that they're going to get for the next 6 to 9 weeks. Remember, treats, you don't want to upset that balance. And you can actually do your own limited ingredient food trial to see if your pet symptoms improve on that. Also, IgA deficiency can be a common problem in certain breeds like German Shepherds. And that IgA is an essential part of the mucus layer in the GI tract. So we have an entire immune system in the GI tract that's very important at being able to identify toxins and help keep those toxins inside the GI tract rather than passing through, say, that leaky or inflamed gut lining. And if IgA is deficient in that mucin layer, then we tend to have more leaky gut problems. And so you can actually do an immunoglobulin testing through Cornell University that checks IgA, IgG, and IgM. And there's certain treatments you can use if that's the case to help boost IgA levels locally in the gut. Now, here's some more of those nutritional tests. So Nutriscan, I do not recommend the blood tests for food sensitivities. They check for allergies. They're checking for IgE. That is not specific. It is not sensitive. It is a waste of your money. And then also remember, you can do that limited ingredient food trial. One of the other things that we can do too is we can check vitamin, mineral, and heavy metal status. So this is where doing a hair tissue mineral analysis test can give you an idea of the cellular health status of your pet over the past 3 months. Your blood, you can do blood tests, but keep in mind that's showing a snapshot for that day that can be affected by any food that was ingested over the past 24, 48 hours. So it doesn't give you the long-term nutritional status of your pet. And I want you to keep in mind healing times. And the prescription for addressing any symptom or condition on this inflammatory spectrum or chronic GI disease or any type of chronic health issue is not all about making like instant home runs or quick fixes. Instead, it's the daily wins of making like the right food selections, caring for the body that will help you reverse and heal that disease. But you'll never know when to hit the ball if you don't look for the source of your pet's health problems. So I want you to kind of shift your mindset a little bit. And the question should be, where are my pet's health problems coming from? And this paradigm of thinking about pet health is a whole new way of looking at healthcare beyond the give me something for my pet's symptoms. So keep that in mind. Think about how long has my pet had these GI health issues? Add on 1 month of healing. So for example, a year of the problem will take at least 1 month to start seeing results. And you tend to go through some ups and downs. That's very common and that is normal. This is where journals are really, really powerful, because if your pet's going through a down, you can go to that journal and go, wow, I actually went like 2 weeks longer before the down. That's good progress. And so a lot of times you also notice too that they get over that issue faster. So the diarrhea doesn't last as long, or they feel good rather than not feeling good. They're down for like the whole week, or you didn't have to go to the vet for that problem. You were able to support them through that down and get them to the other side. So that's very, very important for us to shift our mindset, shift how we look at health issues, and keep in mind those healing times, because it is very different from conventional medicine, where we're used to giving a drug and fixing a symptom and seeing results potentially, especially with steroids, right away. When we're using these natural remedies, when we're using food as medicine, it does take time for us to heal. But the difference is you're healing the root issue so that the body regains homeostasis and balance. And one of the biggest things I want you to keep in mind, we tend to look at symptoms, right? Even if we're using natural remedies, we have to look at all the different pillars of health. And if we miss one, we tend to not have as good healing results. So yes, we're talking about gut health and nutrition, but don't forget about how immune health plays a part, how the environmental health plays a part, how emotional health and stress play a part, and of course, how physical health. So enrichment, getting outside, moving, are your pets overweight? All of these pillars come together to create optimal health and prevent disease, or help us treat disease if your pet has a condition. Hey pet parents, it's Dr. Katie, the natural pet doctor. I hope you enjoyed this episode. If you did, can you do me 2 simple favors? Number 1, share it with someone else. And number 2, subscribe to this channel by clicking down below so you continue to get updates every time I release new videos to help your pet thrive. Also, if you are wondering how you can help your pet achieve optimal health with the guidance and support of a holistic vet, an amazing community, make sure to schedule a call at the link below to learn more about our lifetime healthy, holistic pet for life blueprint program. Look forward to seeing you on the next video. Until then, remember, you are not alone in helping your pet thrive naturally and live their best, most vibrant life. Take care.